Hello, everyone. Thank you so much for joining us for our Menopause Makeover webinar. I am Dr. Benita Stevens, and today I'm so excited to share some information with you guys that I hope will help you to stop feeling like a hot mess. Again, I am Dr. Benita Stevens, and I am a board certified obstetrician and gynecologist. I'm also board certified in obesity medicine. I am the owner and founder of Bella Medical Center and Spa. At Bella, we believe in enhancing your beauty, your life, and your vitality. These days, I spend most of my off time running marathons. I've had the privilege to run the 6 world majors, so I'm excited about seeing what I can accomplish in the future. But one of the things that allows people or drives people to the office to see me is the fact that they're concerned about their weight. A lot of times they're trying to figure out what's going on. Why am I gaining so much weight despite doing all the activities that I'm used to doing and eating the same way I've always eaten? Does any of this sound familiar to you? Some of these people are coming in, they're complaining of hot flashes, night sweats, fatigue. They're having difficulty sleeping. They're waking up in the middle of the night. They're often having trouble with their memory. Some people are noticing things like vaginal dryness, pain with intercourse. They're noticing some brain fog. And one of the most top symptoms that they complain of is decreased libido. So if any of these symptoms sound like you, I think you need to pay attention so we can stop feeling like a hot mess. So what is a hot mess? Essentially, it's menopause. Sometimes these symptoms can begin in your early 40s, but clinically, the average age of menopause is around 51, and it's defined as a cessation of your menstrual cycle for a completion of 12 months. So you want to go 12 months without having a period, and then most people will assume that they're in menopause. Now, unfortunately, it just doesn't happen like that. Sometimes these symptoms begin sooner, and we call that a perimenopausal phase. So you start to see a decline in your hormones over the years, and you start noticing little symptoms here and there until you get to full-blown menopause, where you start noticing that all of these things are starting to affect you. We also have situations where if you undergo a hysterectomy and maybe your ovaries are removed at the same time, then you can go through what's known as surgical menopause. And then some women actually are experiencing medically induced menopause, usually due to some type of medication that we have given you, oftentimes in the form of cancer treatment. Now, when I saw this photo, I was thinking, man, what if I could feel like this again? What if I could feel free out in the fresh air with no responsibilities, not worrying about any hot flashes of night sweats? I'm sure some of you guys would love to feel free like this again too. So if you do want to feel like that, then I suggest you take a look at our menopause makeover. What is a menopause makeover? It is a head to toe refresh that provides the body exactly what it's missing. Now, some of the ways that we're going to focus on this is optimizing your hormones. We're going to look at intimate wellness. Of course, we're going to look at weight management. And then after you start feeling better, of course, you want to look better. So we're going to take a look at some skin rejuvenation procedures. So the key to this menopause makeover is providing a comprehensive approach. No two people are alike, and although we're all kind of similar in aspects, you want to have someone that can look at the individual needs for you. See if weight is a problem for you. We want to look and see if hormones is a problem for you. So we have you come into the office and we do a full exam and history, and we are able to kind of tailor this program to be specifically what's needed for you. Now, when we're first looking at it, we want to start off at looking at your 6 major female hormones. The top 6 are going to be estrogen, progesterone, testosterone, pregnenolone, cortisol, and DHEA. These are your major hormones that tend to cause most of the symptoms that we talked about in the earlier slides. Now, one of the things to remember is that your hormones can also affect your physical and emotional levels. So although you're having hot flashes and night sweats, you oftentimes will notice significant fatigue, and you'll notice that your moods are off, or even your family members might tell you that your moods are off. So the top 3 hormones that we want to look at is estrogen, progesterone, and testosterone. These are your major sex hormones. So when we look at the positive effects of estrogen, we know that estrogen is instrumental in controlling hot flashes. It helps to maintain collagen in the skin. It's going to help with increase in serotonin and dopamine. These are your happy hormones. These are the things that make you want to get up and go and make you want to go out and accomplish things in life. It helps to maintain bone density. It's going to increase that bone strength. It's going to help with your memory. And it also helps prevent neurodegenerative conditions. The other thing that a lot of people don't realize is that estrogen is very instrumental in helping with controlling your cholesterol levels. And then it protects the bone, the breast, the brain, and the heart. So one of my favorite hormones is progesterone. The big thing about progesterone is that the levels begin to decline after age 30. This is long before we start to notice the decline in estrogen. However, by the time we get to age 50, there's a more significant decline in progesterone. And by the time you've had a decline in estrogen and progesterone, you're likely to start noticing those usual symptoms that most people know as menopause. Progesterone is very advantageous in protecting against osteoporosis. It helps with protecting against heart disease, and it's also apoptotic to breast cancer cells. Some other positive benefits of progesterone is that it is very instrumental in helping you lose weight. It's going to help keep your estrogen levels in check. It may offer some protection against some of the cancers. It's very instrumental in preventing hot flushes and night sweats. A lot of times, if your progesterone levels are off, you'll start to notice headaches. One of the big benefits of progesterone is it helps you to sleep. Progesterone is major at helping with sleep and supporting your mood to help with things like anxiety and depression. Now, I love this little cartoon. It's interesting. He's over here looking at 101 positions that he probably wants to try with her, and she's thinking about 102 different excuses of why she doesn't want to try these positions. And oftentimes, this is what I'm seeing with my patients on a day-to-day basis. We get to the point where the kids are out of the house and we have the opportunity to spend with our significant other, but because of the unwanted side effects of menopause, we actually don't want to quite engage in some of those things. So let's look at testosterone. Just like we talked about with progesterone, we often will see a decline in testosterone in our 30s and our 40s. The benefit of testosterone is that it helps to improve your libido and your orgasm. So if you think about it, in your early 30s and 40s, if you're starting to notice a decline, you're also going to notice that you're not as interested in sex as you may have been. And you're also noticing that you're having difficulty with orgasm. The other big benefits of testosterone is that it helps to build bone, it helps to decrease excess body fat, and it helps to increase your muscle mass and improve mental clarity. The positive effects of testosterone include things such as improving your memory, enhancing your libido. It helps with depression and anxiety. Testosterone is really one of our feel-good hormones. It gives us energy, vitality, and that overall zest of life. It helps to improve muscle strength and bone strength, and it helps to reduce our body fat. Now, this cartoon is a trip. She's like, I'm a victim of identity theft. Unfortunately, menopause has took a happy, slim, sexy woman and turned her into me. Now, I hope most of you all aren't feeling like her, but if you are, we can help you not feel quite like how she's feeling in this picture. Now, besides the top 3 hormones that we've talked about, which are estrogen, progesterone, and testosterone, there are some other important hormones that we want to address. And one of the main ones that we want to talk about is cortisol. Cortisol is our body's main stress hormone. It is released from the adrenal glands at any signs of stress, and that stress can be in a form of physical, emotional, or mental stress. You can think of it as an alpha hormone because we literally need it for survival. Now, that's great when you're running from a tiger in the forest or something like that. But unfortunately, because we live such stressful lifestyles, we're seeing cortisol being released all the time. And when it's being released like this, it's causing our body to put on excess weight gain because we're storing a lot of our energy as fat. Now, one of the biggest roles of cortisol is to mobilize energy from storage sites in the body for immediate use. It's going to help us reduce inflammation and allergies. And it's very effective in preventing the loss of sodium in the urine to help maintain blood volume and blood pressure. And it also helps with maintaining our mood and emotional stability. Again, if you start to have an excessive amount of cortisol, you're going to notice that it's going to stimulate insulin production. And this insulin production is going to cause more storage of fat, which oftentimes you will see as an excessive amount of belly fat. So how do we fix this? Well, one of the main ways we like to help with these changes is with bioidentical hormone replacement therapy. BHRT can be utilized to treat women and men who experience imbalances or drops in their naturally occurring hormones. These hormones are responsible for most of your essential bodily functions. So when they are disrupted in any way, you can see a cascade of effects across all of your systems. One of the benefits, some of the benefits of BHRT is that it can improve your mental clarity. It can help with that low sex drive or decreased libido. It can help with anxiety or depression. It is also beneficial in improving your fatigue and fibromyalgia and helping with insulin resistance. Other benefits that we see is, of course, some of the most common symptoms: hot flashes and night sweats. This is probably two of the most bothersome symptoms of menopause. And with bioidentical hormone replacement therapy, we're able to help with hot flashes, night sweats. We're able to help you to start sleeping better, which should translate into some weight loss and also help to regain your interest in sex and decrease the pain that you often may feel as a result of decreased estrogen. Now, speaking of pain with intercourse, we can use the hormones to help with some of those generalized symptoms, but often women still are noticing a lot of vaginal atrophy, or as we define it now, or as we call it now, genitourinary syndrome of menopause. Now, with this, we are noticing that there's alteration of the epithelial level of the mucosa. When we start seeing estrogen levels decline with menopause, the epithelium starts to get thinner and it becomes more susceptible to trauma. And oftentimes women would notice that as more pain with intercourse. If you look at the pictures here on the slide, you look at the picture in box A, this is a picture of a postmenopausal woman's vaginal mucosa that's showing atrophy due to decreased estrogen levels. You see a reduced presence of vessels and a significantly thinner epithelium and a lack of glycogen. But if you look at the mucosa on the right, this is one of a healthy reproductive age woman. This mucosa is well supplied with blood, and the epithelium consists of a larger number of cell layers, particularly rich in glycogen. So they often won't experience this pain and trauma during sexual intercourse because it's a more healthier epithelium. Now, what are some of the symptoms that you notice with genitourinary syndrome of menopause? Vaginal or vulvar dryness is a common symptoms. Women are also feeling burning. They're having pain with intercourse. And a lot of times they're starting to feel like they're constantly having symptoms of a urinary tract infection, like pain with intercourse, an increased urgency to go to the bathroom, and an increased frequency of urination. The pathogenesis of this whole cascade effects is really due to a decline in estrogen levels. When you have this decline in estrogen level, you're going to notice a reduction in blood flow and vaginal secretion, which you would experience as vaginal dryness. You will oftentimes will see morphological alterations in the epithelium of the vaginal mucosa, as we showed on the earlier slides. And then we also see decreases in vaginal lactobacilli. And this is your healthy bacteria that's in the vaginal area. And when you have a decline in this, it increases the vaginal pH level and oftentimes can predispose you to have more vaginal infections. So when we look at the prevalence of GSM, we see that it occurs in approximately half of postmenopausal US women. So we know that there's a lot of women out here that's experiencing these atrophy-related symptoms, and the negative effects of these symptoms are causing a substantial change in their quality of life. Now, unlike vasomotor symptoms that will sometimes tend to lessen over the years, or maybe we don't perceive them as being more dominant over the years, these genitourinary symptoms don't just spontaneously remit, and they will commonly reoccur when hormones are withdrawn if you've had hormones in the past. So sometimes after a hysterectomy and your ovaries are removed, women will get placed on hormones. But because of our mindset of in the past of using hormones for the shortest period of time at the least amount of dosage, if you try to withdraw these hormones, then oftentimes you will see that you will start to notice these symptoms over and over again, and you'll start having more pain with intercourse like you might have had previously. Talk about some of our current treatment options for these symptoms. Well, one of the first things that you could do is you could replace the estrogen that has been lost. This can be done systemically or locally. Another option is to use lubricants or moisturizers. Now, unfortunately, most women have already tried this before they are seeking help for these symptoms. But another option that can be used is what we know as vaginal rejuvenation procedures. And this can be done through the use of things like CO2 lasers and radio frequency devices. And in the next few slides, we're going to talk about these treatments and how they may be of benefit to you. So the first treatment I want to talk about is the Mona Lisa Touch device. Mona Lisa Touch is a fractional CO2 laser that's used to deliver laser energy to the tissue. This laser is able to work by repairing the tissue lining of your vagina and restoring its moisture. And this is followed by the body's natural healing response. If you look here in this picture, it just kind of shows a picture of the laser. It looks a little bit scary, but it does not require any anesthesia, and this is virtually a painless procedure. The treatment protocol for Mona Lisa Touch is a series of 3 treatments that are spaced out 6 weeks apart. We do recommend that after you've had this set of treatments that you follow this up with a single maintenance treatment yearly. And one of the good things about Mona Lisa Touch is that it can be done very quickly. It usually takes less than 5 minutes to perform this treatment. Women will often notice improvement in pain with intercourse after the first treatment, and this will continue well on into that 3rd treatment. Now, when we look at surveys on how women feel after experiencing this treatment, what we found is that more than 90% of patients at the 1-year follow-up are continuing to show significant improvement in their symptoms over what they felt at their pre-treatment status. So our next treatment that we're going to talk about is Thermiva. Thermiva is a radio frequency treatment that is used to deliver heat at a controlled temperature to the inner and outer vulvovaginal region. This treatment delivers increased blood circulation. It improves vaginal moisture and sensation. It's able to lift the pubocervical fascia for urinary incontinence, and it lifts and tightens the external female anatomy. So with Thermiva, we're able to rejuvenate inside and outside of the female anatomy. The good thing about Thermiva is that oftentimes you will notice an instant change. We're able to kind of see the tissue transforming, as we say, in front of our eyes. Just like Mona Lisa Touch, there's no pain associated with Thermiva and no anesthesia is required. And you can come in during lunchtime, have your treatment done, and return to work the same day, and there's no restrictions with sex as well. Now, who are the appropriate patients for Thermiva? Well, in my office, we say it's hard to find someone who's not, but specifically, it's very instrumental for our perimenopausal and menopausal patients who are experiencing dryness, who are noticing leakage of urine, who maybe has noticed some laxity over the years. The tissue is just not as tight as it used to be. We use it in conjunction with our women who are on bioidentical hormones because it can also help with dryness, just as we would use combination treatments and things like, say, weight loss, where we would advise you to do both diet and exercise. We often like to pair some of these vaginal treatments with bioidentical hormones so you can experience that combination effect as well. Thermiva is great for a woman who may be receiving treatment for cancer and can't use hormonal therapy. We use it for women after pregnancy, women who've had big babies and notice that increased laxity, there's leaking urine from those changes from pregnancy. They're able to experience some significant relief with Thermiva. Thermiva is also good if you're having difficulty achieving orgasm. And another benefit of Thermiva is that if you are noticing excessive hanging of skin and it's starting to bother you when you're maybe riding your bike or wearing your yoga pants, this treatment can help tighten up that tissue and help you to experience less discomfort. Similar to Mona Lisa, Thermiva is composed of 3 in-office treatments. They're done about 4 weeks apart. It takes about 35 to 40 minutes to do this treatment. Again, it is painless and no anesthesia is required. It's safe and it's non-surgical. There is no downtime, so you can resume your usual activities, and you will usually notice an improvement after the first treatment, with results continuing to improve with your second and third treatment. Now, another option that we have is the O-Shot. And the benefit of the O-Shot is that it uses your own platelet-rich plasma. So we're able to draw your blood, spin it down, get that PRP, and inject that back into the tissue. And this PRP contains some regenerating growth factors that are able to help with the improvement of the blood flow and increase the collagen growth in that area and stimulate the collagen that's already there. This is going to lead to increased vaginal moisture, sensitivity, and sensation. And the great benefit of O-Shot, just like Mona Lisa and Thermiva, is that it is non-surgical. Now, our final device that we're going to talk about today is our Empower RF device. Now, Empower is just kind of several treatments in one. This device has radio frequency in it, just like Thermiva, but it also uses microneedling, and we're able to use that in the vaginal area if you're experiencing issues with urinary incontinence. The Empower device can be used to help with vaginal laxity due to childbirth. It helps with dryness. It helps with pain. It helps to improve the appearance of that tissue. And again, it helps with those incontinence symptoms. So with this device, we're able to touch on a whole host of different symptoms that you may be experiencing in one device. The other benefit of that Empower device is that it also has some attachments that we're able to use on the face and the body, as well as in the vaginal area. Now, with Empower RF, we've seen immediate results, and these results continue to improve over time. Again, the treatments are non-surgical, and there's very minimal downtime with it. It's a great treatment for young women following childbirth, and it's also well suited for older women who are experiencing difficulty with intimacy due to dryness and pain with intercourse. So when you think about all of our different treatments, they all kind of touch on the same symptoms of vaginal dryness, pain with intercourse, leakage of urine, difficulty with orgasm. But depending on what's going on with you, your budgets, and kind of the time constraints that you may have will determine which one may be a benefit for you. Now, finally, after we fixed your hormones, we've looked into your vaginal health, the next thing is your skin, because one of the things that we know is that when you lose hormones, you can start noticing some changes in your skin. So what can we do to treat it? Well, when you start noticing these skin changes, you may start seeing things like sagging and a loss of plumpness in the skin. Oftentimes their skin appears to be more dry, and you notice more flakiness and itching. You may start to see things that people may refer to as age spots or dark spots that are found throughout your face. One of the biggest things is unwanted facial hair. This is a big one. No matter what, it seems like there's always an extra hair that seems to pop up once we start going through these menopausal changes. And then sometimes, just like you may have noticed earlier in life, you start to have acne breakouts that are similar to what you may have experienced during puberty. So we have some different procedures that are helpful to help with this sagging around your neck, your jawlines, and your cheek, and can help with some of those fine line and wrinkles that you will see as a result of loss of hormones. And just like we said earlier, one of the benefits of our Empower RF device is that we have the Morpheus 8 device included with it. So this Morpheus 8 device is a non-invasive facial treatment that uses radio frequency technology and microneedling to stimulate collagen production and to tighten the skin. So Morpheus is one of our giants. We can use Morpheus in the face, and we can use it in the vagina. And we use that radio frequency technology and microneedling to do somewhat of the same thing, just in a different area. This is going to help to improve the appearance of fine lines and wrinkles, as well as tighten that sagging skin. It comes with minimal downtime, making it a convenient option if you have a very busy schedule. And just like some of the vaginal procedures, once you have that first treatment, you will notice effects of the treatment almost immediately. But as you go on with your second and your third treatments, you're going to see optimal results for the sagging of the skin and the fine lines and wrinkles. Now, of course, we're looking at the hormones, we're tightening the vagina, we're making changes to the face, but one of the most bothersome symptoms that ultimately brings a patient to my office is their body weight. Usually, as you start to gain weight during this menopause transition, you start wondering, I wonder if it's my hormones. Now, the average woman is going to notice a weight gain of about 5 pounds, sometimes 10 to 15 pounds during this transition. But this weight gain seems to be related to really the changes in our lifestyle. As you start to age, the body fat is going to start to accumulate because we're losing testosterone. So you're not building muscle as you used to. You're probably not exercising like you used to. So your lean muscle mass is starting to decrease. And so you're starting to notice the changes on the scale. And because of the loss of testosterone and progesterone, then oftentimes you're not sleeping well. And so if you don't sleep good, then it's often hard to lose weight. So as you can see, it's like a cascade of effect that can happen as you start to lose these hormones. And so this often will trigger into that one big symptom of, I'm doing everything I used to do, I'm eating the way I used to eat, I'm exercising like I used to, but I'm still gaining weight. So again, it's when you look at the weight gain for menopause, one of the biggest changes is that you have increased fat in that abdominal region, as opposed to kind of like all over that we may have seen prior to menopause. And this has to do with specifically with the loss of our hormones, particularly testosterone. And one of the hormones that we haven't talked about as much, which is DHEAS, which helps with improving that body fat. And DHEAS can also convert into testosterone and estrogen. So when we look at optimizing our body weight, we want to look at various areas. Not only do we want to focus on optimizing our hormones, we want to make sure that we're getting the physical activity that we need to get. We want to make sure that we're eating correctly. We want to set realistic goals that will support long-term lifestyle changes. You want to have support from a clinical staff, as well as support from your family and friends. And you also can find different weight management tools that will be helpful to help you along this process. So at our office, we also provide a medical weight loss program. And in our weight loss program, we do an initial consultation where we're doing a full history and physical exam. We provide B12 injections and lipotrophic injections. We have IV hydration. We do a complete blood panel where we're looking at your lipids, your thyroid, your A1C levels, all of those different things that can also be affected by this increased weight gain. And then we prescribe prescription medications that may be helpful with you doing this weight loss journey. When it comes to our follow-up visits, you're able to continue to get those injections. We will repeat the lab work if needed, if there was some abnormalities that we found early on the initial screen. And then you can also have IV hydration sessions that can be useful with improving your energy levels throughout the process. We have a host of nutritional supplements that are also available to support this process, like multivitamins, omega-3, and mitochondrial support agents that can help you with that energy boost that you need. So after we've talked about this, I want to ask you, will you continue on that old path of just thinking that, well, I'm just getting old and this is just going to happen to me, so I might as well just succumb to it and just deal with it? Or are you ready to take a new path? And if you're ready to take a new path, then I invite you to take the next step. Give our office a call at 770-683-9136 to set up your consultation visit today. We will help you to figure out what needs to be focused on. Is it your hormones? Do you need a vaginal procedure? Do we need to focus on your diet and your lifestyle changes? What are the big things that are needed to help you to get back to how you used to feel and get back to that picture that we saw earlier where you're feeling alive and free? So if this sounds like something that you're interested in or something that could be a benefit to us, give us a chance, give our office a call, and we're ready to help you on your wellness journey. If you want to learn more about Chowbella Medical Center and Spa, please follow us on our social media channels. We're active on Facebook as well as Instagram, and you can see our different channels listed here on the screen. Thank you guys so much for your time and your attention during this webinar, and I hope that you are excited about transitioning through this menopause journey, and you know that you don't have to feel like a hot mess and that there are successful options that are available for you.